Greetings, everyone, and welcome to Magical Medical Tour. I'm Dr. Glenn Wollman. I'll be your medical guide along with Christina as we travel each week through the healthcare galaxy, searching toward optimal health. And we're still searching. I think we're coming closer, though.
We are. Well, yeah.
And speaking of guests, we have a very special person on today. This is a colleague and a dear friend of mine. Her name is Barbara Abruzzo. So we're going to learn many things today about healthcare from every point of view. But I think the thing that's most interesting for me is I know that many people talk about healthcare and how it needs to change and how it's broken and all of these problems that they have with it. Well, Barbara is one of the true pioneers in making change because of all of her experiences. She is at the forefront of helping to change the way the system works and the way people can benefit from that. So I would like to, at this time, introduce our audience to Barbara Abruzzo. Christina, Barbara.
Hello, Barbara. Thank you for honoring us here at YHTV.
Hi, Christina. Hi, Glenn. How are the both of you?
We're
doing
bouncy.
great.
That's great. That's great.
From an integrative point of view, are you seeing more doctors that are open to integrative or combinatorial medicine? And are you seeing doctors that are more caring and holistic in a sense?
So it's hard for me to judge, am I seeing more, because my go-to is to always look, even if a doctor doesn't consider himself or herself holistic or integrative, I look for practitioners, doctors as well as other practitioners who, as I said before, are relational. And to me, that is somebody who went into medicine because they really love helping people. You know, they're very people oriented. It would be a doctor like you, someone who's very communicative but also brilliant, is really knows the whole clinical piece, but really cares about what's happening to this human being and whether they're frightened or not, or do they understand, that really understanding that there's more than just a diagnosis and the treatment is either medication or surgery. That many times just sitting with a patient and listening to them is so healing in and of itself. That the patient feels that this person really understands the whole picture. So I because my go-to is to do this. Like I every year I'll go to the Integrative Medicine Conference here. It's going to take place again the end of February in New York City. And it's a wonderful conference, but it's like singing to the choir. The only people that are there are the integrative medical doctors and practitioners. So we all know each other, but you step out of that conference and everything that's going on from, they'll have somebody who's talking about Tai Chi and meditation, and breath work in terms of healing. And of course, all the other things from homeopathy to osteopathy and, nutritional intravenous and always nutrition and lifestyle management. But you step outside of that. Many times when I am working with a patient and they need a good surgeon, or let's say picking a good cardiologist, I would love to find a cardiologist in every case who's also practicing integrative medicine, but that's very difficult to do. And so what I tell the client is, this is a great doctor, clinically competent, very relational, but may not buy into the whole nutritional piece as well as the supplements. So, feel free to ask this doctor about it, but the doctor may either tell you, I don't know, or may just tell you not to do it because they don't know. Because as you know, Glenn, in medical school, most doctors spend about 2 hours on nutrition. And unless they're trained, they go after their training to study nutrition. It's only now starting to change where some of the medical schools are really making that part an important part of the program.
Barbara, is there anything that we have not discussed that you really wanted to bring up before we come to a conclusion today?
I feel that it's very important that people realize first that they stay as healthy as possible for as long as possible by taking great care of this vehicle that carries around their spirit. It's really important. Your body really needs really healthy living foods and clean air and love and joy and less stress. But when you're in a crisis, it's really important to reach out to someone like myself or people who label themselves as patient advocates, healthcare advocates. I define what I do as healthcare navigation specialist, or someone like Glenn Wollman, so that you have the support and guidance. And I would always recommend that that person be a medical doctor or a registered nurse, that you have the support and guidance of someone who really understands the system and knows what a good doctor looks like, knows what good care looks like, and can help you make good choices for yourself so that you or your family member can get the best and the right care.
I'm grateful to my very special guest, Barbara Abruzzo, for sharing her wisdom and experience, an amazing experience with all of the things that she has done and continues to do for all of us in terms of the healthcare experience. I want to thank all of my teachers and all of those that have helped me in my healing process so that I may continue on my journey. I look forward to seeing everyone next week as we travel through another section of the healthcare galaxy. So until that time, thank you so much, Barbara and Christina, and I wish everyone optimal health.